Question 1. A practical nurse (PN) is caring for a client post-appendectomy on the first postoperative day. The client reports moderate pain at the incision site, rates it 5 out of 10, and states, "I feel a bit nauseous." Upon assessment, the PN notes bowel sounds are hypoactive, abdomen is soft but tender to palpation around the incision, and the client's vital signs are stable. Which of the following actions should the PN prioritize? A. Administer the prescribed antiemetic and reassess nausea. B. Administer the prescribed opioid analgesic and reassess pain. C. Encourage the client to ambulate to promote peristalsis. D. Assess the client's last bowel movement and flatus. Answer B. Administer the prescribed opioid analgesic and reassess pain. While all actions are relevant, addressing the client's pain is often the priority, especially post-surgery, as uncontrolled pain can lead to increased stress, delayed healing, and reduced mobility. Administering the opioid analgesic will directly alleviate the client's reported pain, making other interventions like ambulation or assessing bowel function more tolerable and effective. The practical takeaway is to manage acute symptoms impacting client comfort and recovery first, then address other less urgent issues. Question 2. A practical nurse (PN) is providing discharge teaching to a client with newly diagnosed type 2 diabetes mellitus. The client states, "I understand I need to watch my sugar, but I don't see why I can't have a small piece of cake on my birthday." Which is the most appropriate response by the PN? A. Eating cake will cause your blood sugar to spike and is strictly forbidden. B. It's better to avoid all sugary foods, as consistency is key in diabetes management. C. You can have a small piece of cake if you plan for it by adjusting other carbohydrates and monitoring your blood sugar. D. Consult with a dietitian. They can provide a meal plan that includes occasional treats. Answer C. You can have a small piece of cake if you plan for it by adjusting other carbohydrates and monitoring your blood sugar. This response promotes client autonomy and a realistic approach to diabetes management, emphasizing that complete deprivation often leads to poor adherence. Teaching clients how to incorporate occasional treats by planning, adjusting other carbohydrate intake, and monitoring blood glucose empowers them to manage their condition within their lifestyle. The core concept is individualized care and encouraging self-management through flexible strategies rather than rigid restrictions, which can lead to feelings of failure or resentment. Question 3. A client with chronic obstructive pulmonary disease, COD, is admitted with increasing dyspnea. The practical nurse then observes the client is using accessory muscles to breathe, has pursed lip breathing, and reports feeling air hungry. Oxygen saturation is 88% on room air. The PN applies oxygen via nasal cannula at 2 liters per minute as prescribed. Which assessment finding indicates a need for immediate reevaluation of the oxygen therapy? A. Client's respiratory rate decreases from 28 to 22 breaths per minute. B. Client reports feeling less air hungry, but is lethargic. C. Client's oxygen saturation increases to 92%. D. Client continues to exhibit pursed lip breathing. Answer B. Client reports feeling less air hungry, but is lethargic. While an improved oxygen saturation and decreased respiratory rate are positive, the development of lethargy is a critical sign that requires immediate reevaluation. In clients with COPD, excessive oxygen can suppress the hypoxic drive to breathe, leading to carbon dioxide narcosis, which manifests as confusion, lethargy, and decreased respiratory effort. The practical takeaway is that for COPD clients, oxygen therapy must be carefully titrated to maintain adequate oxygenation without causing respiratory depression, and any change in neurological status warrants immediate attention. Question 4. A practical nurse, PN, is reviewing medication orders for a client. The client has a prescription for Digoxin 0, 25 mg PO daily. The PN notes the client's apical pulse is 56 beats per minute. What is the most appropriate action for the PN to take? A. Administer the Digoxin as prescribed, as the pulse is within an acceptable range for some clients. B. Hold the Digoxin and notify the registered nurse, RN, or physician immediately. C. Reassess the apical pulse in 30 minutes and then decide whether to administer. D. Administer the digoxin and document the apical pulse rate for the next assessment. Answer B. Hold the digoxin and notify the registered nurse, RN, or physician immediately. Digoxin is a cardiac glycoside that slows the heart rate and strengthens cardiac contractions. It is a critical nursing responsibility to hold digoxin and notify the prescriber if the apical pulse is below 60 beats per minute, as administration could further decrease heart rate and lead to bradycardia or other adverse effects. The practical takeaway is to always adhere to medication administration parameters, especially for high-alert medications like digoxin, and to escalate concerns to the appropriate healthcare professional when parameters are not met. Question 5. A client with a new colostomy expresses fear and anxiety about managing the stoma at home. The client states, "I don't think I can ever do this on my own. It's so disgusting." Which is the most therapeutic response by the practical nurse, PN? A. Many people live full lives with a colostomy. You'll get used to it. B. It's normal to feel overwhelmed initially. Let's review the steps for changing your pouch again. C. Don't worry, your family can help you with the care at home. D. What specifically about the colostomy care makes you feel disgusted? Answer B. It's normal to feel overwhelmed initially. Let's review the steps for changing your pouch again. The most therapeutic response acknowledges the client's feelings as normal while offering practical support. It's normal to feel overwhelmed initially. Let's review the steps for changing your pouch again. Validates the client's emotions, normalizes their experience, and then immediately pivots to an actionable, supportive step. This approach demonstrates empathy and provides concrete assistance, fostering confidence in the client. The core concept is active listening, validation, and providing education or re-education based on identified client needs. Question 6. A practical nurse, a PN, is preparing to administer a medication via nasogastric NG tube that is connected to suction. What is the most appropriate action for the PN to take? A. Administer the medication directly into the NG tube while suction is running. B. Crush the medication, mix it with water, administer, and then immediately restart suction. C. Clamp the NG tube for 30 to 60 minutes after administering the medication before restarting suction. D. Disconnect the NG tube from suction. Administer the medication, wait 5 minutes, and then reconnect suction. Answer C. Clamp the NG tube for 30 to 60 minutes after administering the medication before restarting suction. To ensure proper absorption of medication administered via an NG tube, the tube must be clamped for a period after administration, typically 30 to 60 minutes, before restarting suction. This allows the medication to remain in the stomach and be absorbed, rather than being immediately suctioned out. The practical takeaway is that when administering medications via an NG tube connected to suction, always pause the suction to allow for medication efficacy, following established guidelines for the duration of the pause. Question 7. A client with a history of alcohol use disorder is admitted with pancreatitis. The client reports severe abdominal pain, nausea, and tremors. The practical nurse observes the client is restless and slightly disoriented. The client's vital signs are BP 150/90 mmHg, HR 110 BPM, RR 24 breaths/min, temp 37.8 degrees C. Which of the following is the PN's priority concern? A. Managing the client's abdominal pain. B. Monitoring for signs of alcohol withdrawal. C. Administering intravenous fluids to prevent dehydration. D. Assessing for complications of pancreatitis. Answer B. Monitoring for signs of alcohol withdrawal. While all listed concerns are important for a client with pancreatitis and a history of alcohol use, the client's restlessness, disorientation, elevated blood pressure, and tremors are strong indicators of impending or active alcohol withdrawal. Alcohol withdrawal syndrome can rapidly escalate to seizures, delirium tremens, and cardiovascular collapse, posing a life-threatening emergency. Therefore, monitoring and managing potential alcohol withdrawal is the priority to ensure client safety. The practical takeaway emphasizes considering a client's full medical history and anticipating life-threatening complications related to coexisting conditions, especially withdrawal syndromes. Question 8. A practical nurse, PN, is caring for an older adult client who is experiencing sudden confusion and disorientation. The client's family reports this is a new change. Which initial action should the PN prioritize? A. Orient the client to person, place, and time every few hours. B. Review the client's medication list for any new prescriptions or changes. C. Notify the physician of the client's change in mental status. D. Assess for signs of infection, such as urinary tract infection, UTI. Answer D. Assess for signs of infection, such as urinary tract infection, UTI. In older adults, acute changes in mental status, often referred to as delirium, are frequently caused by underlying physiological issues, with urinary tract infections, UTIs, being a very common and often subtle culprit. Therefore, assessing for signs of infection is a crucial initial step to identify a potentially reversible cause quickly. While reviewing medications and notifying the physician are important, ruling out common physiological causes like infection first helps guide further assessment and intervention effectively. The practical takeaway is to always investigate underlying reversible causes for acute mental status changes in older adults, starting with common physiological triggers. Question 9. A practical nurse, PN, is observing a student PN preparing to administer a subcutaneous injection. The student selects a 25-gauge, 1-inch needle. The client is a thin, older adult. What corrective action, if any, should the PN take? A. Instruct the student to use a 27-gauge, half-an-inch needle instead. B. Advise the student that a 1-inch needle is too long for a thin client. Suggest a 5/8-inch needle. C. Confirm the student has chosen the correct needle length and gauge for a subcutaneous injection. D. Explain that a 23-gauge needle would be more appropriate for faster medication delivery. Answer B. Advise the student that a 1-inch needle is too long for a thin client. Suggest a 5/8-inch needle. For subcutaneous injections, a 1-inch needle is typically too long for a thin client and could inadvertently reach muscle tissue, which is not the intended site. A 5/8-inch needle is generally more appropriate for subcutaneous injections, especially in thinner individuals or older adults with less subcutaneous tissue, to ensure the medication is deposited in the correct layer. The practical takeaway is to always select needle length based on the client's body habitus and the intended injection site to ensure medication is delivered correctly and safely. Question 10. A client is scheduled for a barium swallow in the morning. The practical nurse, PN, is providing instructions. Which instruction is most important for the PN to include? A. Maintain NPO status for at least 8 hours before the procedure. B. Expect loose, chalky white stools for a few days after the procedure. C. Drink plenty of fluids after the procedure to help eliminate the barium. D. Inform the radiologist if you have any allergies to shellfish or iodine. Answer A. Maintain NPO status for at least 8 hours before the procedure. For a barium swallow, maintaining NPO nil puros status for at least 8 hours prior to the procedure is crucial to ensure an empty stomach. This allows for clear visualization of the esophagus, stomach, and duodenum and prevents aspiration during the procedure. While other instructions are important post-procedure, NPO status is the most critical pre-procedure instruction for client safety and diagnostic accuracy. The practical takeaway is to prioritize pre-procedure instructions that directly impact client safety and the success of the diagnostic test. Question 11. A practical nurse, PN, observes a colleague accessing a client's electronic health record, HR, of a client they are not assigned to and states, "I was just curious about their diagnosis since they've been here for a while." What is the most appropriate initial action for the observing PN? A. Report the colleague to the nursing supervisor immediately for a breach of privacy. B. Confront the colleague privately about the breach of client confidentiality. C. Remind the colleague about the importance of client confidentiality and organizational policy. D. Document the incident in an incident report and submit it to management. Answer C. Remind the colleague about the importance of client confidentiality and organizational policy. The most appropriate initial action is to privately remind the colleague about the importance of client confidentiality and the organization's policy regarding accessing client records. This approach offers a direct, educational, and immediate intervention at the lowest level of intervention. While reporting may be necessary if the behavior continues or is a pattern, starting with a direct, professional reminder can prevent further breaches and reinforce ethical conduct. The practical takeaway is to address breaches of professional conduct directly and professionally at the earliest opportunity, emphasizing education and policy adherence. Question 12. A practical nurse, PN, is caring for a client with a new peripherally inserted central catheter, guideline. Which of the following assessment findings should the PN report to the registered nurse, RN, or physician immediately? A. Client reporting mild discomfort at the insertion site. B. A small amount of serous drainage observed around the dressing. C. Redness and swelling observed proximal to the insertion site. D. Client's temperature is 37, 5 degrees C, 99, 5 degree F. Answer C. Redness and swelling observed proximal to the insertion site. Redness and swelling proximal to the insertion site of a PICC line can indicate complications such as phlebitis, cellulitis, or even a more serious localized infection, potentially leading to a bloodstream infection. These signs warrant immediate investigation and intervention to prevent further complications. While mild discomfort and minimal serous drainage might be expected, and a low-grade fever could have various causes, visible signs of inflammation or infection along the vein pathway are critical concerns. The practical takeaway is to recognize and promptly report localized signs of inflammation or infection around central venous access devices, as they are high-risk sites for serious complications. Question 13. A client with type 1 diabetes mellitus calls the clinic reporting symptoms of hypoglycemia, shakiness, sweating, hunger, but states they do not have their glucometer at home. The PN advises the client to consume 15 grams of carbohydrates. Which food choice represents approximately 15 grams of carbohydrates? A. 1 cup of milk. B. 1 slice of whole wheat bread. C. Half a cup of juice. D. 3 tablespoons of peanut butter. Answer C. Half a cup of juice. For rapid treatment of hypoglycemia, 15 grams of fast-acting carbohydrates is the standard recommendation. Half a cup, 120 ml of fruit juice, typically contains approximately 15 grams of carbohydrates and is quickly absorbed. While milk also contains carbohydrates, the protein and fat can slow absorption, and a full cup is more than 15 grams. Whole wheat bread has fiber, which slows absorption, and peanut butter is primarily protein and fat. The practical takeaway is to be familiar with quick-acting carbohydrate sources to effectively manage acute hypoglycemia, following the rule of 15. Question 14. A client with a urinary catheter complains of lower abdominal discomfort and states, "I feel like I need to pee." The practical nurse, PN, notes there is no urine draining into the collection bag, and the tubing appears patent. What is the PN's priority action? A. Administer a prescribed PRN analgesic for bladder spasms. B. Check for kinks in the tubing and reposition the client. C. Irrigate the catheter with sterile saline as per protocol. D. Notify the registered nurse, RN, or physician. Answer B. Check for kinks in the tubing and reposition the client. The most common and easily correctable cause of a lack of urine drainage in a client with a urinary catheter who feels the urge to void is an obstruction, such as a kink in the tubing or the client lying on the tubing. Checking for kinks and repositioning the client is a simple, non-invasive, and often effective first step that the PN can perform independently. If these actions do not resolve the issue, then further interventions like irrigation or notifying the RN/physician would be necessary. The practical takeaway is to always start with the least invasive and most probable causes when troubleshooting equipment issues. Question 15. A client with a history of heart failure reports sudden onset of severe shortness of breath, a cough productive of pink, frothy sputum, and is visibly anxious. The practical nurse, PN, assesses crackles in both lung bases. Which of the following is the most appropriate initial action by the PN? A. Administer a prescribed PRN diuretic such as furosemide. B. Place the client in a high Fowler's position. C. Apply oxygen via non-rebreather mask at 10 to 15 liters per minute. D. Notify the registered nurse, RN, or physician immediately. Answer B. Place the client in a high Fowler's position. While all actions are critical in managing acute pulmonary edema due to heart failure, placing the client in a high Fowler's position is the most appropriate initial action that a PN can implement immediately to improve breathing and reduce venous return to the heart, thereby decreasing pulmonary congestion. This action can be performed while simultaneously calling for assistance or preparing other interventions. The practical takeaway is to prioritize non-pharmacological interventions that can rapidly improve respiratory status in emergent situations while awaiting further orders or assistance. Question 16. A practical nurse, a PN, is caring for a client who is receiving intravenous or fluids. The PN observes swelling, coolness, and pain at the fore-insertion site. The PN recognizes these signs as indicative of which complication? A. Phlebitis. B. Infection. C. Infiltration. D. Thrombophlebitis. Answer C. Infiltration. Swelling, coolness, and pain at the fore-insertion site, accompanied by a sluggish or absent fluid flow, are classic signs of infiltration. Infiltration occurs when fluid leaks into the surrounding subcutaneous tissue, rather than entering the vein. Phlebitis involves inflammation of the vein, redness, warmth, palpable chordee, while infection would typically present with pus, fever, and significant pain. Thrombophlebitis combines a thrombus with vein inflammation. The practical takeaway is to routinely assess sites for signs of complications and to recognize the distinct manifestations of common related issues like infiltration to ensure timely intervention. Question 17. A client is scheduled for a surgical procedure and expresses concern about signing the consent form, stating, "I don't really understand what the doctor explained, but I'm sure it's fine." What is the most appropriate action by the practical nurse, PN? A. Reassure the client that the doctor is very competent and sign the form. B. Explain the procedure to the client in simpler terms and then have them sign. C. Notify the surgeon that the client has questions and does not fully understand the procedure. D. Document the client's statement and proceed with the preparation, assuming implied consent. Answer C. Notify the surgeon that the client has questions and does not fully understand the procedure. Informed consent requires the client to fully understand the nature of the procedure, its risks, benefits, and alternatives. If a client expresses a lack of understanding, it is the responsibility of the healthcare team, specifically the surgeon, to provide the necessary information until the client feels truly informed. The PN's role is to ensure the client understands and is competent to sign, not to provide the primary explanation or force consent. Therefore, the PN must notify the surgeon that the client has questions and does not fully comprehend the information. The practical takeaway is that the PN acts as a witness to the client's signature and their understanding, not as the explainer of the procedure itself. Question 18. A practical nurse, PN, is performing wound care for a client with a stage 3 pressure injury. The wound bed has a significant amount of yellow slue. The PN anticipates using which type of dressing to debride the wound? A. Hydrocolloid dressing. B. Alginate dressing. C. Hydrogel dressing. D. Transparent film dressing. Answer C. Hydrogel dressing. Hydrogel dressings are excellent for facilitating autolytic debridement in wounds with slue or necrotic tissue, as they provide a moist wound environment that helps soften and remove non-viable tissue. Hydrocolloids are typically used for light to moderate exudate and autolytic debridement, but might not be as effective for significant slue. Alginates are for highly exudative wounds, and transparent films are for minimal exudate or as a secondary dressing. The practical takeaway is to select wound dressings based on the wound's characteristics, such as exudate level, presence of slue or eschar, and the goal of treatment, g. debridement, absorption, protection. Question 19. A client with a new prescription for warfarin is receiving discharge education from the practical nurse, PN. Which statement by the client indicates a need for further teaching? A. I should avoid eating large amounts of green leafy vegetables. B. I will need to have regular blood tests to monitor my INR. C. If I miss a dose, I should take 2 pills the next day to catch up. D. I will use a soft toothbrush and an electric razor to prevent bleeding. Answer: C. If I miss a dose, I should take 2 pills the next day to catch up. Skipping a dose of warfarin and then taking a double dose to compensate can lead to an increased risk of bleeding due to a sudden increase in the anticoagulant effect. If a dose is missed, the client should be instructed to take it as soon as remembered on the same day, but not to double the dose. The practical takeaway for anticoagulant therapy is that strict adherence to the prescribed dose and schedule is paramount, and clients should never self-adjust their dosage without consulting their healthcare provider, especially regarding missed doses. Question 20. A practical nurse, PN, is assessing a client with a suspected opioid overdose. Which assessment finding is most indicative of an opioid overdose? A. Pinpoint pupils and respiratory depression. B. Dilated pupils and tachycardia. C. Warm, flushed skin and agitation. D. Hypotension and severe headache. Answer: A. Pinpoint pupils and respiratory depression. The classic triad of opioid overdose includes respiratory depression, pinpoint pupils, meiosis, and decreased level of consciousness. Respiratory depression is particularly life-threatening, as it can quickly lead to hypoxia and cardiac arrest. Recognizing these specific signs allows for prompt intervention, such as administering naloxone, which is critical for client survival. The practical takeaway is to prioritize immediate recognition of life-threatening symptoms associated with drug overdose to ensure timely and appropriate reversal interventions. Question 21. A practical nurse, PN, is caring for a client who requires a sterile dressing change. During the procedure, the PN inadvertently touches the sterile field with an unloved hand. What is the most appropriate action for the PN to take? A. Quickly resume the dressing change, as the contamination was minor. B. Discard all sterile supplies, read on sterile gloves, and restart the procedure. C. Replace the contaminated item only and continue with the dressing change. D. Apply alcohol-based hand rub to the unloved hand and continue. Answer: B. Discard all sterile supplies, read on sterile gloves, and restart the procedure. Any break in sterile technique, such as touching a sterile field with an unloved hand, renders the entire field contaminated. To maintain client safety and prevent infection, all sterile supplies must be discarded, and the procedure must be restarted from the beginning with new sterile equipment. There is no minor contamination in sterile procedures. The practical takeaway is that strict adherence to sterile technique is non-negotiable, and any compromise necessitates a complete restart to protect the client from potential infection. Question 22. A practical nurse, PN, is assessing an older adult client who recently fell at home. The client reports mild pain in the hip but is able to bear weight with assistance. Which assessment finding would cause the greatest concern for the PN? A. Mild bruising noted on the hip. B. Client's fear of falling again. C. Slight external rotation of the affected leg. D. Client's refusal to ambulate without a walker. Answer: C. Slight external rotation of the affected leg. Slight external rotation of the affected leg after a fall, even with mild pain and ability to bear some weight, can be a subtle but critical sign of a hip fracture, especially in older adults. Hip fractures can present with varying degrees of pain and may not always prevent initial weight bearing. While other findings are important, this specific musculoskeletal alignment deviation points directly to a potential severe orthopedic injury requiring immediate medical evaluation. The practical takeaway is to be highly suspicious of hip fracture in older adults after a fall, even if symptoms appear mild, and to meticulously assess for characteristic positional changes. Question 23. A practical nurse, a PN, is providing education to a client on how to use a meter-dose inhaler, MDI, with a spacer. Which statement by the client indicates effective learning? A. I should inhale quickly and deeply as I press down on the canister. B. I will shake the inhaler well before each puff and breathe out slowly. C. I will press down on the canister, then inhale slowly and deeply through the spacer. D. I should take multiple puffs in quick succession if I feel very short of breath. Answer: C. I will press down on the canister, then inhale slowly and deeply through the spacer. Correct use of an MDI with a spacer involves pressing down on the canister, then inhaling slowly and deeply through the spacer, holding the breath for 5 to 10 seconds. This technique ensures the medication is delivered effectively to the lungs, minimizing deposition in the mouth or throat. Inhaling quickly or taking multiple puffs in rapid succession are common errors that reduce medication efficacy. The practical takeaway is to emphasize the importance of proper inhaler technique, especially the coordination of pressing and inhaling slowly, to maximize therapeutic benefit and reduce side effects. Question 24. A practical nurse (PN) is asked to assist a registered nurse (RN) with the administration of blood products. The PN scope of practice does not allow for independent administration of blood products. What is the most appropriate action for the PN? A. Proceed with assisting the RN as long as the RN is present and directly supervising. B. Decline to assist, citing the limitations of their scope of practice. C. Request clarification from the nursing supervisor about this specific task. D. Assist with the vital signs and client monitoring, but not the physical administration. Answer: D. Assist with the vital signs and client monitoring, but not the physical administration. While a PN scope of practice typically excludes the independent administration of blood products, they can often perform tasks that fall within their scope of practice to assist the RN during the procedure, such as obtaining vital signs, monitoring the client for reactions, and documenting observations. Declining entirely might be overly restrictive if assistive tasks are within scope and direct administration is clearly outside. The practical takeaway is to always be aware of and practice within one's regulated scope of practice, but also to understand how to contribute effectively and safely within a collaborative team, assisting with tasks that are within one's competency while the regulated professional performs tasks outside the PN scope. Question 25. A client is experiencing a severe allergic reaction to a new medication, manifesting as widespread urticaria, dyspnea, and a feeling of impending doom. What is the practical nurse (PN's) immediate priority action? A. Administer a prescribed antihistamine. B. Elevate the head of the bed to ease breathing. C. Prepare for emergency administration of epinephrine. D. Notify the registered nurse, RN, or physician. Answer: C. Prepare for emergency administration of epinephrine. The client's symptoms, widespread urticaria, dyspnea, impending doom, strongly suggest anaphylaxis, a life-threatening emergency. Epinephrine is the primary and most critical treatment for anaphylaxis, as it acts rapidly to reverse bronchospasm, vasodilation, and airway edema. While elevating the head of the bed and notifying the RN/physician are important, preparing for immediate epinephrine administration and administering if within scope or assisting the RN is the life-saving priority. The practical takeaway is to recognize the signs of anaphylaxis quickly and understand the urgency of epinephrine administration. Question 26. A practical nurse, PN, is performing a blood glucose assessment on a client with diabetes. The client's result is 3.2 mol/L. The client is awake but slightly confused and diaphoretic. What is the most appropriate initial action? A. Give the client a glass of water and recheck blood glucose in 15 minutes. B. Administer 15 to 20 grams of a fast-acting carbohydrate orally. C. Notify the registered nurse, RN, or physician immediately. D. Administer glucagon intramuscularly as per protocol. Answer: B. Administer 15 to 20 grams of a fast-acting carbohydrate orally. A blood glucose level of 3.2 mol/L with symptoms of hypoglycemia, confusion, diaphoresis, indicates a need for immediate intervention. Since the client is awake and able to swallow, Administering 15 to 20 grams of a fast-acting carbohydrate orally is the priority. Glucagon is typically reserved for clients who are unconscious or unable to swallow. Notifying the RN/physician comes after immediate action to correct the hypoglycemia. The practical takeaway is to promptly treat symptomatic hypoglycemia with oral carbohydrates if the client is conscious and able to swallow, then reevaluate. Question 27. A practical nurse, a PN, is educating a client with a new prescription for an iron supplement. Which instruction is most important for the PN to include to maximize absorption and minimize side effects? A. Take the iron supplement with milk to prevent stomach upset. B. Take the iron supplement on an empty stomach with a glass of orange juice. C. Expect your stools to become black and tarry, which is normal. D. Avoid taking the iron supplement with any other medications. Answer B. Take the iron supplement on an empty stomach with a glass of orange juice. Iron is best absorbed on an empty stomach, and its absorption is significantly enhanced by vitamin C, which is found in orange juice. Taking iron with milk or antacids can decrease absorption, and black, tarry stools are a normal side effect, not a reason to avoid other medications generally, though timing might be adjusted. The practical takeaway is to provide specific, evidence-based instructions for medication administration that optimize therapeutic effects and educate clients on anticipated side effects to prevent unnecessary alarm. Question 28. A practical nurse, a PN, is assessing a client with a history of deep vein thrombosis, DVT, who reports sudden chest pain and shortness of breath. The client's vital signs are BP 110/70 mmHg, HR 105 BPM, RR 26 breath/min, O2 sat 90% on room air. The PN also notes anxiety and diaphoresis. What is the PN's most immediate concern? A. Cardiac dysrhythmia. B. Anxiety attack. C. Pneumonia. D. Pulmonary embolism. Answer D. Pulmonary embolism. Given the client's history of DVT, sudden chest pain, shortness of breath, tachycardia, tachypnea, low oxygen saturation, anxiety, and diaphoresis, pulmonary embolism, P, is the most immediate and life-threatening concern. A DVT can dislodge and travel to the lungs, causing a P. The PN must recognize this cluster of symptoms as highly indicative of P and initiate immediate interventions. The practical takeaway is to correlate client history with acute symptoms, especially when assessing for potentially life-threatening conditions like pulmonary embolism. Question 29. A practical nurse, a PN, is caring for a client with Clostridium difficile, C. diff, infection. Which infection control measure is most critical for the PN to implement? A. Wearing a N95 respirator mask during client care. B. Using an alcohol-based hand rub before and after client contact. C. Performing meticulous hand hygiene with soap and water after client contact. D. Placing the client in a negative pressure isolation room. Answer C. Performing meticulous hand hygiene with soap and water after client contact. For C. diff, meticulous hand hygiene with soap and water is the most critical infection control measure. Alcohol-based hand rubs are ineffective against C. diff spores, which are highly resistant. Therefore, physical removal of the spores through thorough washing is essential to prevent transmission. N95 respirators and negative pressure rooms are for airborne precautions, not typically indicated for C. diff. The practical takeaway is to understand the specific modes of transmission for various pathogens and implement appropriate, targeted infection control measures, especially when dealing with spore-forming organisms like C. diff. Question 30. A practical nurse, PN, is preparing to administer a medication to a client who refuses to take it, stating, "I don't need that. It makes me feel weird." What is the most appropriate initial action for the PN? A. Explain the consequences of refusing the medication. B. Document the refusal and notify the registered nurse, RN, or physician. C. Attempt to persuade the client to take the medication by emphasizing its benefits. D. Ask the client what weird effects they are experiencing from the medication. Answer D. Ask the client what weird effects they are experiencing from the medication. When a client refuses medication, it is crucial for the PN to first understand the reason behind the refusal. Asking the client to elaborate on the weird effects they are experiencing allows the PN to gather more information, identify potential side effects, or address misconceptions. This information can then be used to problem solve, provide further education, or communicate effectively with the RN/physician to find an alternative. The practical takeaway is to respect client autonomy and actively listen to their concerns before documenting refusal or escalating, aiming to understand and resolve the issue collaboratively. Question 31. A practical nurse, a PN, is caring for a client with a chest tube connected to a drainage system. The PN observes continuous bubbling in the water seal chamber. What is the most appropriate initial action for the PN? A. Notify the registered nurse, RN, or physician immediately. B. Increase the suction setting to resolve the bubbling. C. Check the tubing and connections for any disconnections or leaks. D. Reposition the client to improve lung re-expansion. Answer: C. Check the tubing and connections for any disconnections or leaks. Continuous bubbling in the water seal chamber of a chest tube drainage system indicates an air leak. The most appropriate initial action for the PN is to methodically check all tubing and connections, starting from the client's chest insertion site and working down to the drainage system, to identify and correct any disconnections or loose connections. This is a common and often easily correctable issue. Notifying the RN/physician is appropriate if the leak cannot be found or resolved, but troubleshooting should be done first. The practical takeaway is to systematically assess and troubleshoot equipment issues before escalating, especially when the cause might be a simple mechanical problem. Question 32. A practical nurse, PN, is assessing a client who has returned from a thyroidectomy. Which finding would be the most concerning and require immediate action by the PN? A. Client reports mild pain at the incision site. B. Client is hoarse and has difficulty speaking. C. Client requests water and can swallow with ease. D. Small amount of serosanguinous drainage on the dressing. Answer: B. Client is hoarse and has difficulty speaking. Hoarseness and difficulty speaking after a thyroidectomy can indicate laryngeal nerve damage or, more critically, airway compression due to edema or hematoma formation, which can rapidly lead to respiratory distress. While other findings like pain or minimal drainage are expected, any changes in voice or swallowing post-thyroidectomy warrant immediate and thorough investigation to ensure airway patency. The practical takeaway is to prioritize airway assessment in clients post-neck surgery, as respiratory compromise can quickly become life-threatening. Question 33. A client with a history of type 2 diabetes and hypertension is experiencing morning dizziness and lightheadedness. The practical nurse, PN, measures the client's blood pressure at 90/50 mmHg and heart rate at 62 bpm. The client's blood glucose is 6.8 mol/L. What is the most appropriate initial action by the PN? A. Administer a prescribed antihypertensive medication. B. Offer the client a snack and recheck blood glucose. C. Assist the client to lie down and elevate their legs. D. Encourage the client to ambulate slowly to improve circulation. Answer: C. Assist the client to lie down and elevate their legs. The client is experiencing symptomatic hypotension, dizziness, lightheadedness, BP 90/50 mmHg, which is often exacerbated by standing orthostatic hypotension. The most appropriate initial action is to assist the client to lie down and elevate their legs to promote venous return and improve cerebral perfusion, thereby alleviating symptoms and increasing blood pressure. Administering antihypertensives would worsen hypotension, and blood glucose is within normal range. The practical takeaway is to address acute symptoms of hypotension promptly by positioning the client safely to improve perfusion and prevent falls, and then investigate the cause. Question 34. A practical nurse, PN, is educating a group of older adults about fall prevention at home. Which recommendation by the PN is the most critical to emphasize? A. Ensure adequate lighting in all areas, especially stairwells. B. Wear loose-fitting clothing to allow for easier movement. C. Avoid all physical activity to reduce the risk of injury. D. Keep throw rugs on slippery floors to provide traction. Answer A. Ensure adequate lighting in all areas, especially stairwells. Poor lighting is a significant environmental risk factor for falls in older adults, particularly in high-risk areas like stairwells. Ensuring adequate lighting helps older adults visualize obstacles and changes in elevation, significantly reducing the risk of tripping or misstepping. Loose clothing can actually increase fall risk. Avoiding all physical activity is detrimental to health, and throw rugs are notorious tripping hazards. The practical takeaway is to prioritize environmental modifications that directly address common fall risks, making the home environment safer for older adults. Question 35. A client is scheduled for discharge following a myocardial infarction. The client states, "I'm afraid to go home. What if I have another heart attack?" Which is the most appropriate response by the practical nurse? 10. A. Don't worry, you're strong now. Just take your medications as prescribed. B. Many people feel this way after an MI. Let's talk about what you can do to manage your risk factors at home. C. Your doctor said you're stable, so there's no need to be scared. D. If you're so worried, maybe you should consider staying an extra day. Answer B. Many people feel this way after an MI. Let's talk about what you can do to manage your risk factors at home. This response acknowledges the client's valid fear, normalizes their feelings, and then empowers them by shifting the focus to actionable strategies for risk factor management. It demonstrates empathy while providing a path forward for self-efficacy. Simply dismissing their fears or stating they are stable does not address the underlying anxiety or provide coping mechanisms. The practical takeaway is to validate client emotions after a significant health event, and then provide education and support that promotes self-management and reduces anxiety about future events.